We're all here today because healthcare is about people. Lorraine's mentioned that. It's about people, and fundamentally it's about the interaction between patients and clinicians. So that's really a really important concept, because a million times or thereabouts every 36 hours across the NHS, a patient comes in through our doors and asks for help. Not only technically competent clinical care, but care that's delivered with compassion, recognising them as individuals. And it's that interaction that defines healthcare, because we are a complex environment. And if you look at any complex system across the universe, whether you look at it at an interstellar galactic level, whether you look at a coral reef or the human body or healthcare, all of those systems rely on the integrity of those fundamental interactions, be it at quantum particle level or in healthcare being at that level of a clinician and a patient interacting, as I say, a million times every 36 hours. Now, every one of those interactions provides us with information, with data, really valuable data at source. And our challenge in the digital age, if you like, is to be able to collect that data in as standardised and as structured a way as we can, so that we can aggregate it and intelligently analyse it. So we can feed back the information from that analysis to enable that interaction to occur most effectively. That's really, really important. We move ourselves from being reactive to being a proactive, knowledge and learning-based organisation, where every single individual can use that information to intelligently change the way they work on a day-to-day basis. So a clinician coming to that interaction needs to know a lot about their patient, and the patient coming to that interaction, we need to give information so that they can be empowered and engaged in that, not a passive recipient, but an actual active participant in that interaction. So yes, we need to know when we sit down what the blood test results are, what the past history is, what the radiology shows, what the pathology shows. That's really important, and we need that when we need it, in real time, in as real-time fashion as we can. But we also need around that interaction a system that is set up that is sustainable. So if you're a surgeon going to the table, about to perform an operation, you need a system around you that enables the support of that. You need the lights turned on, you need the sterile supplies available, you need your nurse rostering to be there so that your scrub sister's there. You need to have the anaesthetist in place, you need to have the right equipment there to do that. Now, in Addenbrooke's it's 40,000 times a year, and across the NHS it's millions of times a year just to do those surgical interactions. Multiply that across the millions of outpatients, and every single time a patient comes to a GP. So the National Information Board has done a fantastic job in setting out a program of work right across the system, which at its very heart enables that information to be collected in novel ways, patient wearables, apps, devices, etc., from the patient side of things, as well as from the big systems that we have available, to be collected in a standardised way so that we take out the unwarranted and unnecessary and unhelpful variation that we see across the systems, to make it as structured as possible so that we can gather it and intelligently analyse it in the same way we can get real-time information, and then enable it to be shared across the system to be where it needs to be at point of care. Underneath that, there are several enablers, critical enablers, interoperability of systems that talk to each other in a seamless way so that we can share that information properly. Data sharing and security, very important. Right at point now with the Caldecott review. How do we share that information effectively? How do we share it in the right way? How do we share it in a secure way with the right people at the right time? That's critical. Standards, absolutely critical, as I've pointed out, in terms of taking away variability. I was at a talk earlier in the week at the King's Fund, and the issue about innovation versus standardisation came up. And it's not an either or, it's an and conversation. We need innovation to occur within a set standards. And once we've decided that innovation has produced something that's effective, we need to embed it into a system that is properly governed by standards. so that we can take out the variation that is so damaging to what we do on a day-to-day basis. That way we will lift the performance of the whole system, we will create sustainability, and the whole point about that is to improve patient outcomes. The leadership piece in terms of, as Lorraine again is critical, getting people engaged on both sides of that equation, the clinicians and the patients, getting them engaged is really important. So bringing them to the table to be able to use the technology most effectively that we have. So the best technology in the world sat on the shelf, not used, is of no use to anyone. And I think we've been down that road with the NP Fit side of things. So the challenge with the National Information Board programs is to get the balance right between what we do centrally, how we auspice this occurring, but not be too directional in terms of what people want to do on a local basis. We want to facilitate and encourage local engagement, local involvement with this, and set the platform up centrally to enable this all to happen in an effective and seamless way. Because at the end of the day, what it comes down to is that each and every time someone sits down with a patient, 1 million times every 36 hours. That's staggering that we do that day in, day out across the NHS. This whole thing has to be anonymous in the background. People just have to be able to turn on what they need when they need it, without worrying about how it's all connected, without worrying about how it's shared. They just have to know that when they need it, it will be there. And that really is the challenge of what we're doing with the National Information Board programs, what we're doing with the whole digital health agenda. So my role is really, and I know very little about technology per se. Yes, I did implement the EPIC program at Addenbrooke's. And if you want an example of what that's done, that with a push of a button at 2 a.m. on the morning of the 24th of October 2014, we set up a system which 18 months later, just in one small area, has flagged 8,500 times that there could be a problem with a medication that's been prescribed by a doctor. That's led to a change in medication prescribing, usually due to an allergy or something like that. And even at the most conservative level of 10%, you can imagine the huge amount of morbidity that's avoided for patients, as well as the saving of 2,500 to 3,500 acute bed days. That's with one simple prospect of what is a very complex system. That is what we're aiming to do across the NHS in a myriad of dimensions and a myriad of domains. That's the challenge in front of us, but it's also the opportunity. This is the biggest game in town in terms of system transformation. This is the biggest enabler of system transformation that we have available to us. We can shuffle the cards and the deck chairs around how we organise things in terms of geographical footprints and structures, etc. But this fundamentally challenges us to change the way we work, to change the way that we do things day to day, to change the way we look at the workforce, and it challenges to say how can we be more effective with our interactions with patients and produce better patient outcomes. One of the greatest things about this is that we are going to enable patients to be active participants in their own healthcare, to take up that challenge of bringing to the table something which so far has been lacking in that interaction. That's the thing that's going to change healthcare across the NHS. And we can do this and lead the world because we are the only place that can bring together a population of this size with this degree of concordance. It's very easy to get lost in the complexity of what the NHS provides every day. The whole thing around vanguards and pioneers and STPs and transformation areas and policy at the top, the Secretary of State announcements, etc. But Roberta, you've given us you've pulled us right back down to earth and reminded us that